asking me to do this today because I am trying to my best to bring awareness to this unbelievable, fascinating technology, which is the first of its kind. When I got into home care, and do you think that there's such a small turnout because they knew I was presenting today, or
Absolutely.
We've had smaller turnouts.
I figured the room would be packed. I'd be the presenter.
It's July.
A nice chuckle. But anyway, when I first got into this industry, around the same time Susan did, I'm entering my 9th year now.
Yeah, me too.
Yeah, I wanted to make a difference and educate myself the best I could, and I still do moving forward. And I've always said, and I had to bring this, I had to include it, that I don't believe what everyone says. Everyone says to me, and you can see it here everywhere, that one of these doesn't exist. I had to bring this. You know what this is? I believe in the silver bullet. And I've always believed in the silver bullet, trying to strive to find that magic, whatever it may be, to make a difference in our industry. And I firmly believe that this will make a difference. This is the very first technology of its kind. So we do everything accordingly, above and beyond, from A to Z, of course, needless to say. And so what happened was, during my research, I'm constantly researching on finding ways on how to get better, and especially with technologies, because that obviously is the future of just about every industry. And we always have to remember that we are a non-medical home care. We're not a medical home care. So this is not a medical device. It's a wellness device. This is its sole purpose is for detection and not diagnosing. So the short story on how I came to get to know these people, the name of the company is Toy Labs, and their product is called the True Bathroom Technology. It literally is a smart toilet seat. And the one problem I could see already, it's only been on the market for a year. They're just primarily focusing on assisted living style, and I'm doing home care. I'm currently, believe it or not, the only home care agency in the country that has this, and they want to see how it goes and moving forward as far as branding it and marketing it into home care. So during my research, I came across this. I reached out to them, and I was fascinated by the technology, and I kept in touch with them, just learning, understanding. And the more I was speaking with them, I just was like, wow, this is amazing. This could change our lives. This could change the industry for me. And so I even got to know Vic, and I want to tell you a little about Vic before I get into this. Vic is the owner and CEO of this company. Vic, to me, this is no joke, is probably one of the smartest men in the world. I kid you not. He got Harvard, went to Harvard with honors, MIT, Berkeley. He's a big-time software engineer. Actually got recruited to a software company in Japan. Was the head guy in charge there. He learned Japanese in 6 months. He speaks it fluently. That's like wicked smart, like the movie. Well, yeah, Good Will Hunting. And I've had the pleasure of meeting him. He comes to New York a lot. Every time he comes to New York, we sit and we talk. We still text. We bonded. We've created a relationship. So what happened with Vic was he was a software engineer. And when he returned back to the United States, he found out he had ulcerative colitis. And the doctors told him he had to have his colon removed and he'd have to wear an ostomy bag. And he was only 23 years old, I think, when this happened in 2003. And he refused. He says, no, there's got to be a better way. I'm not gonna go that route. So what he did was he actually took time off. And he says, I'm going to study and research this disease for 2 years. And he spoke with doctors, he spoke with scientists, he was working with many top people in the field. And he ended up going to Thailand because of liabilities in the United States, what else is new? And he worked with physicians and other people there. Well, here's the bottom line. He cured himself. The first person ever to do it, he did it. It gets very deep. It's called a human whipworm, and it's kind of gross, to be honest with you, but he literally cured himself, and he did not have to have the removal of his colon or an ostomy bag, and now it's all about diet, so on and so forth. So after he went through this, he said he decided to totally change gears, and he got into bathroom technology because he wanted to make a difference in the world, and he wanted to help other people. So what happened was he started a company called Toy Labs, and like I said, it's bathroom technology. It's the first of its kind. It's the only one in the world. And I constantly talk to Vic, whether through text, whether through calling him up, and he's the nicest guy in the world. So I want to continue to educate myself, and I want to know everything about this. And there is no competition anywhere. You might hear this, you might hear that. It's not the kind of smart toilet you usually think about when you hear the word smart toilet. And also, what I think the problem is, a lot of people unfortunately start making jokes about it, which I kind of don't like because it's a very, very, very serious technology, and it literally it's improving lives, saving lives, and reducing emissions and re-emissions, and that's what we all desire for. So I'll start the presentation now, and okay, this is Executive Care's goals. I mean, of course, like Neil and Susan, want to keep our clients stable, improve their well-being, reduce emissions and re-emissions, first and foremost. But the fourth one I think is most important. It's coordinating the personal care with the 24/7 technology, wellness technology, where even when we're not in the house or assisted living or wherever the client may be, they're getting care. There's something's working for them, and it's totally non-invasive. I think that's very, very critical because it's all about being preventative. So, introduce you to, like I said, it's the first technology of its kind. It's basically exactly what I just mentioned before. And I think also is key that this has the potential. I'm going to show you a couple of slides as I move along. It's like, it astounds me because this has only been around for approximately a year now. So they have created this magic, and it's still getting the awareness. It's still marketing it because that is, to me, 75% of the problem. So many people I find, healthcare professionals. I've printed up a couple of manuals with information, questions, everything, and then and they look at it. Oh, this is great, and then we kind of shoo-shoo it. And I'm like, I just don't get it. I just, it's got to click because this can save the industry millions and millions of dollars. It literally can. There's no question about it. And they're going to prove it. So the next slide. I just wanted to tell you how serious this is. So I included the brain trust. We not only have Vic at the top of the ladder. I told you how his genius, but there's that Vic. That's a picture of Vic. And they partnered with the University of California at San Francisco, which is one of the leading research medical centers in the country. And now you're talking about the roundtable, the brain trust, physicians, scientists, software engineers, hardware engineers, gastroenterologists. It just goes on and on and on. And I've gotten. I don't want it to be just too much information to put on here, but I've seen the brain trust. It's fascinating, the genius behind this.
My name is Vic Kushup. I'm the founder and inventor of the Trulu. This toilet monitoring system is the result of my own personal experience with ulcerative colitis. Trulu is a Wi-Fi connected toilet seat that can attach onto a toilet in a matter of minutes. It automates toileting logging, which in senior living communities is an important aspect of tracking the wellness of our residents. The heart of it is an optical scanning system that is capable of understanding the color, the shape, the clarity, the consistency, the volume. It's able to do this in a way that's completely private and de-identified. And it provides operators with a clear, easy to understand report validated by board certified physicians. In clinical studies, Trulu has been shown to be more than 100 times more accurate and complete. One of the beauties of Trulu is that it requires zero change in behavior on the part of the resident. Millions of dollars have been spent developing this technology, and it's already in use in senior living operators across the country.
So this is how, this is how it basically works. Like I said before, it's got 2 global patents right now. Am I okay?
Your bell has to go off.
The one on the wall.
It's muted.
There we go.
Okay.
It has 2 global patents right now. Mine's muted? Yeah, mine's muted. So there isn't, if anybody's overly worried, it has a little deactivation button on the side of it. So it's in my mom's house and I don't want it to detect that I'm using the toilet. I can just hit the button and no data will be collected. But in saying that, you don't have to hit it because, as I previously stated, it does know the patient, it does know the person using the toilet. It develops that baseline, and if it's not them using it, it realizes it. So nothing will be okay. So like I said before, the baseline, and this is where it gets really critical, and this is where it's amazing, and this is where it could save lives. Because if you really,
Just a quick one, because it obviously detects stool, but it also works on urine as well. Okay, I just want to make sure.
Yeah. Whatever's in the toilet.
Whatever's in the toilet. Okay.
So I added a side note because all of this, I mean, it could detect like dehydration, constipation, especially UTIs, which are prevalent in our industry. And if you think about it, common sense should prevail. First and foremost, we have to wear falls because one fall could lead to disaster. So this can prevent falls. So there's many chronic conditions that it can detect. So I put this in because this is the main issue I'm finding, and I speak to Vic about this. We have very intense conversations, and he is intense he is the desire. He's just unbelievable. And I could see the frustration he's having because moving forward, even though he has, to me, the technology of the future, without a doubt, once the awareness, so when somebody prominent takes note of this and they start to use it and they will see the results and it gets the momentum. I think the main barrier, the problem is because of the subject matter, it's kind of a taboo subject. Nobody likes to speak about it. And there's almost like a barrier there. And even me, I'm having trouble. I only have 3 clients using it right now because so many, including my mother, who I just said, "Wow, why don't you just try it? We'll just put it in." "Nah, I don't want that in my house." I said, "Ma, it's just like you buying a toilet seat from Home Depot. You put it on, you plug it in, and you go about your business, no pun intended." And so, but a lot of people still are like, "No, you're going to take pictures of me," and it's not going to take pictures of me. That's it. Of course. It's
Okay.
in no way. They understand that. And it can, and what I'm saying, this can prolong and save lives. It can. And it's proving it right now. And then no one realizes this, well, because it's in its early stages, but no one on the East Coast has it. No, the doctors aren't aware of it. No one's aware of it.
Is it connected to your health facility?
No, it's
Probably
just
next.
plugged in the house.
No. I know it's plugged in, but all the
I'm gonna explain it to you.
Yeah.
Okay.
I'll get there.
So Kaylee
I'll give
says
you,
You need a marketing campaign like Squatty Potty or Poopery.
Yep.
yeah,
She's all
I'm
about
trying to figure it out, trust me.
It is about marketing.
If-
Kaylee.
Before and after they got
Yeah.
it twice.
Kaylee, I'll talk to you. I'll talk to everybody. I'm signing a contract with a big time video production company because I'm trying everything. So here's the no worries part. Try to get people to understand this. It's no camera. It's just right down the list. Everything's encrypted, secure, private. You don't have to worry about a thing. It creates an image. It's just like any other toilet seat.
So like when all of this data comes in, my grandmother's using this and she starts to urinate more frequently, which shows that she might have a UTI. Who's getting that information?
Yeah, that was my question.
I made it very easy too. I actually created this one. I'm going to show you. Vic was like, "You did that?" I said, "Yeah, little one, we did that." Well, yeah, well, okay, because I love this stuff. All right, I created this wheel, and then just as a prop, I did that
Oh,
too.
that's cool.
I love it.
Now, this is how it works.
You can say, yeah.
But this is exactly how it works. Only I receive the information, not the family, no one else. Because right now, they're in the earliest of stages and for privacy issues, so on and so forth. That's the way they want it. I said, okay, if that's the way you want it, that's fine. It's only me receiving these reports. So basically, here it is. One, the specimens are scanned. Now the data, Vic's office, Toy Labs, the corporation, whatever you want to call it, is located in San Francisco. That's where it is located. So the data is forwarded to their software in San Francisco. Their software analyzes the data. They have 24/7. They have 2 gastroenterologists employed there that are on the job each and every day, along with an RN. They have live living people also there. So the software will process all the
It's the
information.
same stuff that
It's the same, yeah, it's all right.
Oh. Yeah.
I was
Yeah,
trying to
it's the
be
same
clever.
exact thing. It's just like I said, it can't hurt and it adds to the presentation. It's really not to be spitting out. But anyway, so now the software analyzes all of the data, and if it detects an issue, whether it's color, whatever it may be, I'll show you in a second. The board certified gastroenterologist, and an RN, Vic, I've had conversations with this. Then the live aspect of it comes into play. Real people. There's a lot of YouTube videos about this. with a lot of doctors talking about this and the genius and how it works perfectly. So what happens is maybe it was a UTI, maybe one lady in an assisted living in California had cancer. It detected it in its early stage, literally. So now the report is generated, it's forwarded to me, my dashboard. I'll get the report.
Automatically?
Yes, they'll generate it. The physicians or whoever, the team at Toy Labs will generate the report for me. And I'm gonna show you one also. And forward it to me and they'll, oh, we got an issue here. So after you alert the family, explain to them, I could actually forward, email them the report. They can bring it to their doctor, make the appointment at the doctor. They can bring the data to their doctor or forward it to their doctor. And other doctors has firsthand what they're dealing with. And from what I've been told, many doctors in California who are seeing this for some are like, where did you get this? How did you do this? Because before, and how it's done here is obviously you bring your stool, your urine, or it's sampled to the doctor. And so that's it. I'm sorry, that's it. So and lastly, most importantly, they schedule an appointment. They have diagnostic testing, and it could be ulcerative colitis. It could be one of many chronic diseases, or it could be a simple UTI, whatever. So it will be addressed. So that's basically how it works. I think this is a report. Oh, let me go back to one more.
So does it report COVID yet? I'm serious,
Yeah,
that's
I know,
how
it will.
you
I
come.
guarantee you.
They're constantly moving
I know.
forward, and yeah, they're not stopping here, trust
Yeah.
me.
Because
So-
they're letting it in
Why not?
wastewater.
So this-
This will eventually.
It has to be a light
So this is why I'm like, I am obsessed with this. I'm just gonna try my very best, and I love this guy, and I want him to succeed. They spent a fortune on this, and this technology I can't say it enough. It's off the charts. So the cost is not known. Simple chart. Look at the billions of dollars a year because of presentable hospitalizations. How much money could be saved if every resident in an assisted living had one of these? And I've always said this also, and I've talked to many people in assisted livings. Let's say the average lifespan of I should say, stay in an assisted living is 22 months. And if this is in the room and it's detecting, it's working 24/7 around the clock, you don't even know it's there. It's just, like I said,
Do what you do.
Yeah. And all of a sudden you get the red alert, the red flag, and those residents could be there for 28 months, 30 months. Who knows? And it's still, I still have to
Is insurance covering it?
no,
No.
no. Right now, they're not marketing it to the public. They're using it in assisted livings and with me, believe it or not, home care. All of my clients will receive this free of charge. I include it in my plan. I absorb the cost. I'm not gonna, for $29.95 though,
That's cheap.
I include it in the cost.
That's a cheap-
So here's another very critical slide. Preventable hospitalizations. It's like common sense, it's a no-brainer. Just look at the kidney stones, UTIs, dehydration, especially constipation, so on and so forth, and the list goes on. These are all preventable. And it's fascinating how many there are per year. And this could lead to something a lot worse if not detected. So that's huge. And now I think, yes, this is an example of a report. Because like I said, it's in like 7 assisted livings in California, 1 in Texas. And these are the reports. If they're in all the rooms, or how many, it could be half the rooms, who knows? Because they do all the assisted livings they are, and now they have all these assisted livings. They have a great testimonials from executive directors, nurses, so on and so forth, how it's fascinating, how it's working so wonderfully. But so they'll, as opposed to me getting all the data, obviously the nurses or whoever, the executive director, I don't know, will be getting the daily reports. So here's the patient's name, the room number, and what's going on, when they're detecting data. That is a daily report, and then there's a more in-depth weekly report with an image of the problem. It's an image, it's like I said, it's a picture, but it's an image. And,
So it does take pictures, but up to.
No.
right, but it, like I said, it identifies and it won't pick up,
Yeah.
it immediately won't pick up like private parts of your body or anything like that. That's for sure. So, that's
Picture the toilet.
yeah, just,
Yeah.
it's a.
This is like having
I thought it
a
was-
sample that
Yeah.
you bring to the doctor,
Right.
right there.
Right.
It's,
With,
oh, I
with
love
all
it.
sorts of
That's what I thought.
information.
So how do you get started?
Uh, Okay, and this is the final slide. I mean, I could go on and on, but I know it's limited time. So this is, I sincerely believe that this is the, technology of the future, and I'll say, I have to be repetitious. It will reduce emissions and emissions. But it's just up to little old me right now and getting this out there, trying to get in front of people. And I'm gonna show you one other last thing to show you. I mentioned to you that three of my clients are using it now. And this is, I get the reports, and like on the screen, you see this. This is the actual report of one of my clients, and there was blood in the toilet, and they didn't know. I talked to the family, Angelo, I'm not gonna say his last name, so his son, and I forwarded this report to him. He called the doctor, like I said, the physician. He brought in this sheet or maybe he emailed it to him, I'm not sure. Ulcerative colitis. His dad literally was diagnosed with this, and now they're taking care of him.
But because of that, they found out, they probably would have never
Wouldn't,
found
yeah.
out.
A lot
Until
of-
it was a crisis,
A
yeah.
lot, the problem is a lot of, or this, better anybody, the elderly, a lot of times, especially the men, they're too proud and they won't say anything. They'll even see a little blood or whatever, and they won't say anything because it is what it is. So, and especially early, you have to remember, most importantly, also, dementia patients. I mean, it's like early onset and they're not gonna know, so.
Yeah, they just flush the toilet before the caregivers can see it.
Exactly.
Yeah, absolutely.
Exactly.
Because they're embarrassing. So if there's a couple living in the home, does it create a double baseline? Does it know?
Yes, absolutely,
Okay, all right.
positively, 100%. If both have issues, it creates a double baseline.
Okay, so it'll track two
How do they
different
know
people.
which person's which? By weight? How do they know
They-
who's sitting on the
Like
toilet?
I said, the data software detects it. They know who's using it. They
By
know
your
if
poop
there's
profile.
foreign objects in the toilet. It gets pretty deep. I perhaps maybe I should have let them
Yeah.
know, drop them off to you. I've created two manuals, one introductory kind of manual and a more in-depth manual, very brief and short, with a million questions and answers on it. And, like I said, I'm trying my best right now to bring awareness to this, but I see first and foremost that I have to get kind of to the higher ups or get a gastroenterologist or something. That's my goal, and I'm working with a lot of people on how to try to figure this out, because the number one, to me, like I said before, I'm paying for it. It's not even an added expense. If you use us, we'll put it in the whole 9 yards, and you don't have to worry about a thing. It's just a toilet seat, just a regular